Interventions designed to improve patient flow could be another series of videos all on its own. I highly recommend the book Mastering Patient Flow by Elizabeth Woodcock, and also If Disney Ran Your Hospital by Fred Lee. Hillside Clinic had certain parameters that they had to abide by from Quantum Healthcare. Although Quantum was supportive of Hillside's attempts to improve, they required that any interventions that Hillside put in place not have a net result of decreasing the volume of patients that the clinic could see, or have a negative effect on the clinic's already struggling bottom line. For example, Quantum would be supportive of requests for additional staff only if it could be clearly demonstrated that accounts receivable for the clinic improved by more than the cost of new staff. Every project does need parameters. Without limitations to the scope of a project, it's very easy for the things involved to get out of hand. For example, in a medical clinic, it would be very easy to increase the quality of visits by decreasing the quantity. Well, this won't work for effective and quality care. The initial data showed that during the time when all providers were in the clinic, that's when the clinic was the furthest behind. So the Kaizen team and planning the initial intervention required the input of all of the providers. After a brief meeting with all of the providers, a change of schedule was made. The change was made for 1 week for the initial PDSA, which is longer than the ideal time of just a day, but necessary to test the hypothesis that the number of providers in the clinic was a contributor to the backlog. Note that it would have been possible to simply take a provider out of the clinic for a day to run a PDSA, but the schedule was made so that each individual provider's time out of the clinic could be assessed. Each provider was given 1 full day out of the clinic. During half of that day, the provider was expected to see patients by telehealth. Batching telehealth visits was also new to the clinic. The Kaizen team believed that testing both of these interventions simultaneously would be the most effective way to do both of them. Each of the providers already had a half day off for administrative time. With each provider having an entire day out of the clinic, the nursing staff generally working in the clinic with that provider was free to float and assist other providers and other teams. This was how increased efficiency was expected.